Hey, podcast friends. This is Dr. Steve Hewlett with the podcast Simple Healthy Choices for Weight Loss, where every week we help people who have realized that as their health has been declining over the years, the number of medications they are being prescribed is increasing. We want to help you reverse this health path so you can live the vibrant, pain-free, and hopefully medication-free life you deserve to live. If you'd like even more information on this topic, you can go to Amazon or Audible and pick up my book, Your Plate is Your Fate. And if you think my book helps you on your new health path, please tell your friends and leave a review where you purchased it. Hey, welcome back, podcast friends. And today we have another interview, and I really think you're going to find this one very interesting. I sure did. And this is an interview with Dr. Joseph Dills. He's a dentist and a native of Springfield, Missouri. He's a partner at Parkcrest Dental Group. He's a graduate of Drury University and UMKC School of Dentistry in 2001. He's been practicing for 23 years and remains committed to continuing education in all aspects of restorative, cosmetic, and implant dentistry. He served in Rotary, on the board of Children's Smile Center, and remains involved with church and community service. He enjoys spending time with his wife, Kellie, of 22 years, and raising their two children. When not at the office, you'll find him outside golfing, enjoying time on a paddleboard somewhere, or even running. Whole body health and well-being is a hallmark of his approach to life and dentistry. Dr. Dills, thank you so much for doing this interview with me. I think this is going to be very interesting for everybody. And
well, you are welcome, Dr. Hewlett. Thanks for having me.
I guess the first question, just kind of start this off, is, so why do people originally come to the dentist? What makes people go to the dentist in the first place?
That's a great question. I guess I'd answer that with a question. Why do people typically take their car to the mechanic or go visit their physician, right? Warning lights on, check engine light. You go to the doctor typically when you're sick. Pain, swelling, fever, sickness, right? And so we're kind of the same. People often show up on my doorstep with pain, swelling, some kind of dysfunction. So for a good portion of the population, that's the entrance. Maybe not the recommended entrance, right?
Right.
So there's that portion of the population. There's the other portion that's the more proactive, right?
Right.
Do the maintenance, the oil changes, looking at the stats with your doctor and talking about how the machine's running. So different approaches. We see both.
So you shouldn't wait till you have a heart attack to go see the doctor for the first time.
It is an approach. Probably not.
And like you were saying earlier, is like really the causes for someone to come in to see the doctor because of a heart attack, and the cause for somebody to come in because they're having mouth problems really is a whole bottom kind of the same problem, isn't it? In a way.
Yeah, I think it is, Steve, and I think you've hit on that in many of your podcasts. We don't live compartmentalized lives. One thing affects the other, right? What I eat affects what I do. Interestingly, what I do also affects what I eat.
Right.
And so, having done this for, the number you threw out there was impressive, right? You start to see certain trends and things. I guess the biggest impact I can have on people is find a dental home you like, someone you trust, someone's been around. We've been here at Parkcrest for 50 years. That's a milestone. That's big.
Yeah.
And that's privately owned. That's us doctors doing it. It's not a corporate thing. But if we start that journey to health early in life, and even as pediatrics, even as children, then we set ourselves up for a lot better success.
Right. So like what kinds of information would you give to people if they first come in, if they do come in early, what kind of information do you give them as far as good dental hygiene to try to keep them keeping them with just checkups and not anything dangerous that's happening inside their mouth?
Sure. Great question. First thing I'd tell folks is with respect to their kids, get their kids in early, within 6 months of the first tooth. Well, doc, why would you do that? They don't have a cavity. You're right. Most likely not. But establishing that point of care is valuable in the event of trauma. Yeah, baseball games, you bet.
Right.
But also as those children become accustomed to going to a place where they're not threatened, where things are good, we're talking about maintaining health. Should the warning light go off, the introduction is not a frightening one. It's you're going to a place of help.
Yep.
That's one. Two, And you speak to this very well metabolically and all the things that you talk about. Diet impacts the body, yes, but it also impacts the teeth.
Mm-hmm.
So what we know is that a diet high in refined carbohydrates increases the likelihood of tooth loss. Most likely through tooth decay, yes, but also inflammation from periodontal disease.
Mm-hmm.
So if we can establish good habits and find things early, we can reverse that course. You're designed to have teeth for your whole life. I mean,
Right.
it's not 3 sets of teeth, right? The one you're born with, the one you get through adulthood, and then the ones that somebody makes you to live, that you
Right.
take in. No, that's not the design. And it doesn't have to be in many cases. Save, sure, trauma, cancers, these sort of things. But no, they're designed to last a lifetime.
Right.
But you got to put them in the right environment.
Right. So what does nutrition have to do with that? You said refined carbs is what causes a lot of periodontal disease. I mean, what do refined carbs do?
Okay, well, you know this, and most of your listeners do as well. As you eat refined carbs, it does what to blood sugar?
Mm-hmm.
Raises the blood sugar.
Raises,
So
right.
As you do that and you collect a high glucose or high blood sugar, it sits around in the oral tissues as well, the sulcular fluid around teeth. And as we know, what do you grow bacteria on in petri dishes back in the science lab?
Right.
Agar glucose media.
Yep.
So the concept is, no, don't reduce all of it, but let's make sure that we're not eating refined carbs, one, for the simple attack from the bacteria in the mouth, but two, the impacts systemically.
Right. Just overall inflammation, which is crazy because if you look at the food pyramid, that's what they're trying to tell everybody to eat is their basic base of the food pyramid is all carbohydrates, which is absolutely ludicrous. And I talk about that in so many of our pyramid should be turned upside down and that whole top layer eliminated. But so why does that affect anything in the mouth? Are there bacteria in your mouth that live off of it? Or is it just the inflammation, everything that occurs so that poor blood supply to the teeth or a little bit of that and more?
Good question. So, we talk in dentistry, all medicine has got these fantastic terms they use. We like to make stuff complicated. In dentistry, if you go out on the street and start asking people, hey, what's plaque? You'd probably get some vague answers.
Right.
Okay, go out in the streets of the Ozark Hills anywhere, Springfield, Kansas City, wherever near the river, St. Louis. What's algae? Ask any kid that's had a fishbowl, what's algae?
Right.
Now that you can get some concrete answers out of that.
Right.
It's proteinaceous goo, right? It's microbes, it's protozoa, it's bacteria, okay? Interestingly enough, we just turned the word algae into plaque. It's tooth algae.
Huh.
So it's a living organism, right? Which means it metabolizes things, and it likes to metabolize things quickly and efficiently. Carbohydrates.
Right.
Mountain Dew, Dr. Pepper, Red Bull, chocolate milk, strawberry milk.
Fruit juices.
Fruit juices, yeah.
That they tell you are healthy for you. What a crock.
Sweet teas, coffee-flavored milkshakes from Starbucks. You get the idea.
Oh, yeah.
That simply feeds all of the bacteria in the mouth. And if there is a good coating of plaque or algae, tooth algae on the tooth, those byproducts are highly acidic, and that dissolves the hardest substance in the body, which is enamel.
Right.
Once that's dissolved, guess what? Then the underlying surface becomes food for the plaque. The bacteria invade the tooth and then begin the process of eating the tooth. Hence, tooth decay in a cavity is simply a void, right? That's a cavity.
Right.
So what's a cavity? It's a void created by bacteria that have entered the tooth secondary to the acidic process.
Right. And so just brushing with fluoride isn't going to protect that, huh?
Well, oh man, you get rid of the bacteria and guess what? They can't get there. So the concept is if you get rid of that biofilm twice a day, your rate of tooth decay is going to be pretty slim in the absence of, some known things, Mountain Dew, Dr. Pepper. You get the idea. We've been there.
Right. Do you see a lot of diabetics?
Oh, yeah.
Because, is that like a common thing that diabetics tend to lean into if they don't take care of their diabetes?
I don't know. I don't know if it's that I see a lot of diabetics because of tooth decay or that there's that many diabetics in the population.
That's true, too. Sad to say.
Yeah, I look at my sample size and we see some very healthy individuals. We see some, a bell curve. Yeah.
Hmm.
There's a lot of folks on the diabetic drugs, everywhere from the metformins on into the insulins. Again, I think not all health conditions are preventable. But you know what? And you've seen this too, as you change, if you've got a glucose problem, get rid of the glucose.
Right.
Don't eat the
Exactly.
glucose. Okay, fine, great. So,
Which is weird because that actually will cure the type 2 diabetes. I mean, that's what it is insulin resistance. Bring down the glucose, bring down the insulin, recover your insulin sensitivity. It's crazy.
yeah. So
Anyway.
Don't put it in the mouth. Don't feed the bacteria, and you watch your tooth decay rate go down for sure.
Right.
You bet.
Is there a certain bacteria in the mouth that tends to like sugar more and tends to do more dental issues? You had brought up one time when we were talking about strep mutans and the hydroxyapatite and fluorapatite. Is that a main one? Is that something we need to worry about?
Yeah, the strep mutans is the primary driver of tooth decay in the mouth. And you're never going to sterilize the mouth any more than you're going to sterilize the lumen of the integumentary tract.
Right.
You can't do it. But, that's the primary driver. And it likes sugar, you bet. You bet it does.
And so what's it do with sugar? So if bacteria eat sugar, what's that got to do with your teeth? Is it just because you're keeping the bacteria alive? Or then do they start eating on the teeth and eating on the gums? Or is it, like you said, it's more of a metabolite that once they make the sugar, it's something that happens afterwards?
Sure. Their byproduct is acidic. And the enamel is soluble in acid, which really, Steve, is why, the sugar-sweetened beverages give you the double attack. You've got the carbs, but you've also got a highly acidic drink.
Exactly.
Doing a lot of work for you, or against you, I guess, rather.
Right. for the strep.
Yeah, for the process of decay, yeah. So that's something to be aware of. I've had some patients, interestingly enough, we talk about getting the biofilm off of the teeth, right?
Mm-hmm.
So they dive into the abrasive toothpastes. I had one physician, neat guy, spent 20 years brushing his teeth with baking soda, dry brushing with baking soda.
I've heard that. That's how I grew up as a child.
Guy came to see me in his 60s and says, "Man, my teeth are yellow. Can we fix it?" No, he didn't have any decay. He didn't have any enamel either.
Right.
And the yellow was the underlying dentin, which he was eroding too, but he'd worked through all the enamel with the sodium bicarbonate.
Oh my gosh.
Well, we can use a generic name, Tom, to make your teeth white. Yeah, we got to do things, but let's get rid of the baking soda. There's some alternatives. So you mentioned the fluoride toothpaste. What does that do? Well, fluoride's naturally occurring. And this as a pharmacist, there's biphasic capacities to many drugs.
Right.
I can kill mice with warfarin, or I can help people with clotting problems.
Right.
Depends on my dose.
Right.
Fluoride's kind of the same way. We discovered that people with fluoridated water supplies naturally had less tooth decay. This is where that was born, as you're doing a survey. Why does this population have all this going on and this population not? Well, it was illuminated that, that's because there's fluoride in their water supply, not added to, but as a natural occurrence.
Right.
So some light bulbs went off and people decided to try that, add it to toothpaste, that sort of thing.
Right.
Effective, yeah. Can you overdo it? Yeah, sure. You bet.
Like adding it to the water supply. Not a smart thing to do.
Well, no, I argue if there's no fluoride in the water supply, put it there. You bet. Because otherwise people won't get it. And unfortunately, people are going to continue to eat all the things. So it has a protective effect. And it's a reversible, it's a topical effect. It's not that you ingest it there, it does its magic.
Right.
Its magic is topical.
Mm-hmm.
You mentioned hydroxyapatite, which is the mineral component of teeth. Kind of nerding out here. We're going down into.
Well, I never know who my listeners are. I have a feeling a lot of them are people who have no medical background and some who have a little bit and are thirsting for more. So this is for them.
Okay, so hydroxyapatite, right? To those that know, HA, major component of bone, but it's also the major component of tooth enamel. Well, it is soluble in acid. Interesting thing that happens when we use a fluoride toothpaste or a topical fluoride, be it via the water supply, be it applied in a gel, whatever, there's a reversal, or not a reversal, but a change of that hydroxyapatite to a fluoroapatite crystal. It's reversible. It will flip back to HA. But while it's in its fluoroapatite form, it is less resistant to acidic attack. Okay, That's why it works. That's the magic. So no, we don't need to inject fluoride.
Right.
No, it's topical. And you find it, as the chew the fluoride tablets when you're a kid, you're getting the topical action as you apply the gel, topical action.
Right.
That's where those things are born of.
I was also wondering, because we talked about baking soda and that being a base, to kind of help, negate the acid part. But I know that, just like in when you go to the grocery store shelves, you see all this man-made products and they advertise something on the front of the bottle like, made with real olive oil. And when you turn around and look at the ingredients, it's all vegetable and seed oils. And then they have olive oil down, like the very last ingredient. Oh, yeah, we whiffed this over it because they know what people want to say, even though they don't put it in there. Is that kind of what happens also with like baking soda? If you get a toothpaste that has fluoride and baking soda, is there enough baking soda to actually cause a basic reaction and to help with that acid? Or is that even what it's for? Is it more for the scum?
Yeah, I think it's more the abrasiveness. I don't think there's enough. And this is my feeling, right? There's no scientific data on this, but my guess is the amount of baking soda present in a smear of toothpaste is pretty small. Okay. I don't know you're going to get a lot of buffering action out of that. Not like dumping 30 pounds into your swimming pool.
Yeah, really. So what is proper nutrition for the teeth? I mean, is there, what tends to make a mouth happier? Is there a specific food that is like, this, if you stay away from this and stick to this, chances are you're going to have a healthier mouth? Yeah.
Wouldn't surprise you if I told you it's all the same things that support a healthy metabolism and body, would it?
It surprised me a lot.
It's the same stuff.
Yeah.
No,
so a healthy body, healthy mouth, it's all the same thing, right?
Yeah. Interestingly, I find folks that eat healthy have healthy teeth.
Mm-hmm.
It's a truth. You can't get away from it.
Right. Which also leads me to thinking like chewing. I mean, it seems like I would just think, usually like if you're wanting to strengthen your bones, you put stress on the bones and your body will put calcification into the bones. It makes them stronger. Anytime we stress anything, if you run, you make the heart stronger. If you read and learn, you make the brain stronger. I had that's a bad example. But it seemed like chewing, just actual chewing, seems like that would make your teeth, your jaws, everything stronger and healthier. Is that true? And is that something that may be a problem? Because when you eat man-made carbohydrates, people just really don't even chew that much anymore. Just everything just dissolves in the mouth and lets the bacteria run wild, as well as everything else. Is that true or is that not true? I mean, I don't know.
No, there's truth in that. You bet. And we see that in the mouth. My really good chewers, my guys and gals that have got good diets, they're eating the salads, the vegetables, the steaks, the lean meats, the stuff that requires the chewing, right? They develop a healthier bone structure, and you can see it physically in the mouth. They'll have wider, denser jaw bones. They'll have more dense bone on radiology than the frail patients who are, they're metabolically compromised. Let's just call it what it is.
Right.
The Wolff's law of bone physiology, right? You apply force, it responds.
Right.
You bet. The more you use it, the stronger it becomes, so to speak.
The reason that came up, because I know that's a big question or a big thing that people state when they had been so used to eating man-made food and they switch over to start eating healthy. And so they start eating more meat. And that's something they say they'll be sitting there chewing on a steak or something and their jaws just get tired. Mine did the exact same thing. I mean, you have to stop in the middle of chewing, just kind of let your jaws rest and then go again. And now it's not that way anymore. Now I can pound down a 16-ounce steak, with no problem, never stop chewing. So that's why, I wondered, is that something that if people don't change their eating habits that way, will that make the jaws kind of get worse and worse? Like as you see people older that are also frail, or do they tend to have more mouth problems? Or I don't even know if you'd be able to know that.
I'm thinking about just kind of, my patient population that I see in some of the various stages of of aging. Yes, I guess you could say that, Steve. My healthier, more active adult patients, and I'm talking my folks in their 80s and 90s that are still out there doing it, and there are a lot of those that I see.
Mm-hmm.
Yeah, they've got good teeth and jaw structure. And my guess is that's because they've used them over the years.
Right.
Not eating, people used to talk about that. Well, Grandpa ate bacon and eggs and butter every day and lived to be 90.
Mm-hmm.
Yeah, probably.
Yeah.
He was eating real food.
That's exactly right.
You bet he did. So yeah, there's a direct correlation there. And interestingly, people when you lose a tooth, the first thing that happens is the bone that held the tooth, the alveolar bone, it collapses. It goes away, and it goes away in all dimensions, vertically, horizontally. And so without stimulation of the jawbone, it goes away. Patient who has prosthetic teeth, dentures or partial dentures, where the teeth are missing within the first 3 months of the extraction, you lose about 40 to 60% of that bone right off the top. It just goes away. It's not needed. Body says, I don't need to maintain the structure.
Right.
Get rid of it. So for rehabilitating lost teeth, my take home is as soon as you can, put an implant back in that place, because that will stop the bone loss. It now stimulates the jawbone to stick around, and you can rehabilitate that site correctly.
Now, what do you mean by an implant? Just like actual dentures where you can take them in and out, or are you talking about something that actually gets implanted into the jaw? I mean, I don't know.
Great question. So dental implants have been around for more than 30 years. And the concept is you've got a tooth in your mouth. The part you see is the crown of the tooth, the top.
Mm-hmm.
Well, there's a root structure there too, right? Like an iceberg, you see the tip, there's the base.
Right.
A tree, the root system. So the implants, what it does is it is implanted in the jawbone. Most are made out of titanium for some very good reasons. That root form is placed in the jawbone, and then a tooth is attached to it. Or you can use that implant, same concept, to attach dentures or multiple teeth to. So it is a way of replacing with a rigid structure what 40 years ago was replaced with either something removable that comes in and out, right, or a bridge. So it opened the door to rehabilitating things, especially my patients that lose things from trauma or from fracture. There's stuff happens to teeth, not just decay.
Right. And jaws.
Yeah.
Gums. Yeah.
So you can rehabilitate that in a lot of cases if the bone is there, and that's reliant upon is that bone being used.
Right.
Do and function with.
So that makes me think also of what's called root canals. They used to do that, and now I hear they're not doing that much anymore because of issues, but I haven't followed it, so I don't know why. Do you guys do root canals still?
Oh, yeah.
Is that a thing of the past? Or?
Oh, no, all the time. So if you let's talk about what that really means, a root canal. Sure. If you look at a tooth, think of a hard-boiled egg. That's a good visual. You've got a shell, you've got a white and a yolk, okay? Well, that's much a tooth. You've got enamel, mm-hmm, you've got the dentin, then you've got the pulp, the root canal, okay? The middle of the tooth is the canal where the nerve lives. So that procedure is simply, if you were a hard-boiled egg, we're going to take out the yolk and put new yolk in it, or a sealer in where that yolk was, mm-hmm, so that you maintain the egg. It's just the diseased or necrotic part of that tooth has been replaced with something else.
Right.
So it's done very commonly and very successfully, about a 95% success rate for that procedure long term. That's pretty good. If I'm going to Vegas, mm-hmm, and I'm going to bet the mortgage, I'll take a 95% odd, you bet.
Right.
Our implant restorations, again, replacing the entire tooth, we're about 95 to 98%, depending on the jaw and the physiology. Very good odds. So a root canal is done. For a while, Steve, there was some different materials that were used or that were not biocompatible. Those caused some problems. A lot of those are now off the market. Sargenti paste was one of them, magic bullets. If done well with a thoughtful provider, I have no problem with that therapy at all. knowing everything. And I always put myself in the patient's position, right? I've got all this knowledge, 23 years of clinical knowledge.
Mm-hmm.
Okay. What do I do with that knowledge? If it's me as the patient in that scenario, based on everything I know, what do I do? Oh, okay. In many cases, yeah, I do the root canal. You bet.
Right.
If that attempt doesn't work, okay, fine. Let's get rid of that entire tooth, allow some healing, and put in an implant. Sure. Beautiful treatment. Beautiful.
Okay. Now, and this is strictly out of ignorance because I have no idea. I always assumed that the pulp, just like the yolk of the egg, is where all, a lot of the nutrients are that feeds the chicken, that allows it to grow, or whatever the word is. So I thought the pulp was the same way. I thought that's where all the blood supply was going, that was actually kind of nourishing the area. And if you take that out and put something else in, you lose that blood supply, and then that doesn't make the tooth last as long. Is that evidently that's not the case?
Couple of layers to that. The answer is yes, that is exactly where the blood and the nerve live, which is within the tooth. And within there's some progenitor cells. In early tooth development, those progenitor cells do things to help the tooth develop. In adulthood, once the tooth is done forming, that nerve tissue, that pulp tissue, the neurovascular bundle and the progenitor cells can become necrotic. Yeah. Okay, so what do you do with that? Well, you either take out the necrotic tissue in its entirety, that is the entire tooth, because you can't have necrotic tissue in the body.
Right.
That's not good. That's a breeding ground for infection.
Right.
Abscess, gangrenous, this sort of thing. Talk to any good cardiologist about a guy with a tooth abscess. Talk to any guy who's replacing joints, hips, knees, about a guy with a tooth abscess. I get a lot of clearance forms from my cardiology colleagues and my orthopedic colleagues. Does this patient have a stable condition where I'm safe to work?
Right. Which is why everybody gets prophylactic antibiotics if you're going in for a tooth procedure, to make sure that doesn't happen.
Yeah, so the guidelines on that with artificial joints and hearts and those sort of things. There's some joint papers that have been written between the American Dental Association and the Orthopedic Association, these sort of things that detail that. So no, you can't separate the mouth and body. We've tried.
Right.
But then you've got the same, the same medical system beating the drum. Don't you dare come at my joint patient with an abscess, and I'm not about to replace a joint with a patient with active periodontal disease.
Right.
Oh, but they're separate compartments?
Right. So what else? I've heard of other things that are good, and I'm not sure why. Like somebody brought up something about tooth scraping and things like that, brushing your teeth. Is that what's the purpose of that? Because I personally, I do brush my tongue every single night, and I don't even know where it started, but young, every time I brush my teeth, when I get done, I brush my tongue, and it makes me feel better. It makes me feel like my teeth's cleaner, but I really don't know if I'm doing okay or if I'm making more damage, or I don't know.
Yeah. No, tongue scraping, it's good. So think back to our analogy of algae, right? Now go to your fish bowl. Algae is not specific. It doesn't grow on just the sides of the bowl. No, it grows on the ornaments and the rock and the bottom and everywhere. So the tooth algae, the plaque, it gets on the tongue, you bet. If it's in the mouth, it's growing there. So scraping the tongue, absolutely, it reduces the biomass in the mouth. Mm-hmm. Yeah, you bet. Good plan.
And what about things like swishing with coconut oil or things like that? I've heard there's people who do that. Is that really
pulling.
A thing?
Yeah, oil pulling. That's gotten some popularity in a number of circles. You read the reports on oil pulling. The concept is I'm going to put coconut oil, which has got some antimicrobial concepts, some properties to it. The process, you put a tablespoon or so of that in the mouth, and you run around swishing it real well for about 20 minutes, and then spit it out.
20 minutes?
Yeah, 15 to 20 minutes.
I don't see me ever swishing something in my mouth for 20 minutes.
Well, I haven't read any really good, well-designed long-term studies on that. But there are some anecdotal or some studies out there that will talk about, it reduced bacteria in the mouth. It reduced gingival inflammation. But again, if I can, with a toothbrush, do that in 2 minutes versus 20, sign me up for that.
Right.
2, I read there's been some reports. You run around with something held in your mouth for 20 minutes, someone slaps you on the back. There have been cases of aspiration pneumonia because of oil pulling. Truly, really.
It doesn't surprise me.
So pick your poison, right?
I thought, well, maybe, I don't see me swishing oil around my mouth for 20 minutes, but yet there's people who swish sugar sweetened beverages around the mouth all day long. So maybe that's where it helps. Instead of doing a sugar sweetened beverage in your mouth, just oil for 20 minutes and it'll decrease the sugar you're putting in there.
Well, yeah, you got 20 minutes. You're not eating gummy worms. You bet.
That's right.
I like it. I like it.
What would you consider good oral hygiene? And I'm assuming from what you've been saying, it doesn't mean just what do you do to fix your mouth or take care of your mouth, but it's the whole body. You got to take care of the whole body. I mean, so what do you usually recommend to people when they come in? And either they come in and their mouth is pretty healthy already, so just can tell them exactly what things they're doing right to keep going, or it's really bad. It's like, you're going to have to switch to this. Do you ever talk to them about nutrition or anything during that?
Oh yeah, all the time. Yeah.
So what do you say?
Depending on the patient, if it's a patient who really is in good shape, quite frankly, if the machine's running well, the program works. So you know what, you're doing great. Keep doing what you're doing.
Right.
If I see some areas that need some attention, okay, tweak this, work a little bit harder. Good oral hygiene is simply getting rid of the plaque in the teeth. And go back to your analogy of algae, right? You can brush teeth. Okay, great. Where those bristles get, all the plaque will go away as long as you're doing it. But where that bristle can't get, which is where every tooth touches right in between, yeah, the algae's there too, you bet.
Right.
The only way to get rid of that is to mechanically break that contact and enter that 4-letter word, floss. Well, 5, but you get the idea. I don't know if I can say this. You can edit it if I can't, but it's the F word dentists use all the time, floss.
Yeah.
Yeah. Without that breaking of the contact, that's where I see the second most common area of tooth decay is right where the teeth touch. See it in a lot of youth, young adults that are running around drinking whatever they're drinking. You get the idea.
Right.
Mountain Dew, Dr. Pepper, strawberry, Kool-Aid, cherry limeades. Yeah, and smoothies, right? No, it's a smoothie. It's healthy.
Yeah, I know. They've really psyched people into believing that too.
Is it an apple with an avocado smoothie, or is it?
Exactly.
So, floss, yeah, you got to do it. You got to brush, you got to floss. Tongue scraping is a great adjunct. I love it. And then diet. Sorry, I interrupted you, Steve.
No, I just real quick, before we go into diet, because we want to talk about the diet also, but what about the difference between manual brush and electronic brushes? I know there's a lot of electric toothbrushes and everything. Are you for or against, and why is one better than the other? Or just whatever works for you is fine.
I've had a handful of patients over the years be able to really do well carrying it home with a manual toothbrush. Can do it. You got to be really diligent with it, and you've got to have some good dexterity to accomplish that. What we have found, and I use Sonicare toothbrush, got one in my travel bag, got one at the house. Man, that just makes life easy, right? Yeah. It's a method of getting the job done.
Right.
We all like gadgets, right? I got a hand grinder for my coffee beans. I can do that, put it in a press and go through that, right?
Right.
The Nespresso doesn't make bad coffee either.
That's right.
So, yeah, we can do it different ways. The thing I've noticed is that with the electric toothbrushes, I see less mechanical damage to the gum tissue than I do with the manual toothbrushes.
Right.
More expensive? Yes. Effective? Highly effective.
Right. Yeah, I can see me, because we switched over, actually, because of your dental group. We switched over. I've always obviously done the manual, and then my wife got the electric, and then got the electric for my boys, and they loved them, and they're like, you got to try this. Your teeth feel so much better. What I've noticed is I like it because it has the one that we have, it has a 30-second pause. So you can count how long you've been doing it, brushing your teeth, and so it keeps me doing it longer. When I did manual, I tended to be very aggressive, and I pushed harder as I was brushing, I was pushing harder on my gums. Whether that's good or bad, I don't know, but I did notice I was doing it, and I don't know if that was wearing the gums away. But the other thing that I mentioned on some of our podcasts, something, we talk about stacking habits and things that you need as you get older, which is balance and flexibility as well as strength, because those are the things you tend to lose. And that's why people, as they get older, they tend to trip, fall. When they fall, they tend to break their bones and yada, yada.
Yeah.
So we stack now. And whenever we brush our teeth, I'll stand on one foot. So I'll stand on one foot while I brush for the first 30 seconds, and I'll switch to the other foot and stand on that for the other 30 seconds and switch back as I'm going through my teeth. And I've never did it when I did it manual, but I have a feeling that's going to be a lot harder if I was standing on one foot and doing it, because it's so easy to just kind of sit there and kind of passively a little bit do your teeth.
Yeah.
I don't know. I may try it, but it's crazy. Something stacking a habit like that has really helped. I mean, I can already tell my balance is a lot better, but that's one thing you can tell people a good positive thing with an electric toothbrush. You can stand on one foot for better.
I like it. Off topic, you know what a body blade is? Have you heard of this concept, a body blade? It's developed by a physical therapist for rehabilitating neuromuscular deficiencies. But Google it. It's fun. Do this on your own time. But Google body blade. They're fun. Now try and stand on one foot and drive a body blade. I'll leave it at that. It reminds me of brushing your teeth standing on one foot with a manual brush.
Yeah. Okay. Body blade. I'll write that down because I have not heard of that.
It's good for balance, neuromuscular coordination, talking about preventing falls, that sort of stuff. A lot of my physical therapist buddies love them. And yeah, I've got one. We train with it at home. You bet.
Okay. We're going to have to look that one up. Now, that's not that blue thing that it's got one thing, you just stand on it, but it's kind of foamy okay. Because we have one of those too, but I don't know what it's called. Yep. Anyway, I know that was totally off subject.
Yeah, I got a little squirrel in there, didn't we?
That's right. I tend to squirrel a lot. But so anyway, you were heading into the nutrition. What do you actually tell people? What do you actually tell people as far as what, the types of food to either increase or decrease in their nutrition?
I've got a saying I like about what to drink. Because patients ask me this all the time. Well, what about diet soda? What about this or that? And my go-to, and it was kind of tongue-in-cheek early on, was, okay, well, if that stuff was so good for us, then why did God fill the rivers and streams with water?
Right.
And why do mamas make milk?
Right.
And it's not strawberry milk or chocolate milk.
Right.
So don't do this, guys. But if you could take a fish and drop it in there and come back a half hour later and still have a fish, it probably supports life.
Right.
It's probably good to drink.
Right.
Otherwise, evaluate it a little bit.
Yeah.
Now, I don't know the effect of a good green tea on fish. I'm not going to do it. I'm not advocating anybody do it. But you get the concept, right?
Right.
So, you go through that. What about sugar-free soda? No, it's highly acidic. It drives insulin response. All those things. No, it doesn't have sugar. But people will do that. They'll take their diet soda and pick up a pretzel. Well, it's not candy. Yeah, it is.
Right.
Yeah, it is. Right. The first thing that happens in the mouth to that pretzel is it becomes simple sugar.
Right. Exactly.
The enzymes in the mouth break it down to simple sugars. You may as well have a full-on Dr. Pepper. You're doing nothing different.
Right.
Label different.
They're only looking at calories. They don't realize, which I've talked about that in the past also, is just the fact they've done studies where you put an artificial sweetener in the mouth, swish it around and spit it back out, and then check your insulin, and your insulin levels do go up. Just the fact that your body tastes something sweet in your mouth, it's your body, as soon as you put something in the mouth, your body's preparing for what it's getting ready to do. It's gone from whatever activity to now, okay, we're getting ready for digestion. Let's get ready. So as soon as it gets in the stomach, it can start taking care of stuff. So, if you're looking at calories, which is a crazy thing. And the only time you ever have to really look at calories is when you're eating all your thing in carbohydrates, because there's no nutrients and nothing but calories basically is what you're eating. But when you eat a good nutrient rich source, like, a good fatty meat or something, then you don't have to worry about the calories as much. Your body will regulate how many calories you can take in when you're eating meat. You're not going to eat it over and over and over again.
Yeah.
But yeah, I tell people that same thing. I mean, there's a lot more in diet soda than just the sugar that they're taking out. It doesn't mean it's good for you by any means. Drop a goldfish in it.
Yeah. We're going to get some calls on that.
Yeah, really. Wait, you said drop a goldfish. That's right. We are saying do not do this.
Yeah. Use the idea. You got it. There's some myths that I run into. People come in, talk about myths. You shared one with me. Well, it's not sugar that causes cavities because it dissolves so quickly. Okay.
Yeah.
Fact or fiction, Mythbusters would say myth. No, that's what drives it.
Right.
Give me a break. I can hold lettuce in my mouth for 10 minutes and really not drive that metabolic process at all.
Right.
I swish for 1 second with even just a quarter teaspoon of sugar, and I've already flooded the mouth entirely with more carbs than those bacteria can possibly deal with.
Right.
Here's the concept. So talking about that, I wake up in the morning and I take a sip of my family member used to drink Coca-Cola religiously. Okay. Sip of Coke at 8 o'clock. Okay. From 8 a.m. to 8:30, the bacteria in the mouth are producing acidic environment on one sip of Coke. At 8:30, I take another sip. Okay. Now from 8 to 9, I have an acidic environment with active bacteria metabolism.
Right.
At 9 o'clock, I take another sip. I've had 3 sips, but an hour and a half of acid dissolution.
Right.
Okay.
Which has nothing to do with the sugar that's in it, just the acid.
Well, one, the acid,
and
but
the
two,
soda.
I've just fed all the bacteria a complete diet. They're going to metabolize for about a half hour. Now, saliva is full of all kinds of good stuff. Antibodies, minerals.
Amylase.
Yes. In the absence of the acidic attack through mealtime, the saliva is going to naturally remineralize the teeth. So all day long, you've got this kind of demineralization, remineralization going on. When you eat, there is some demineralization of the teeth based on the acidic process of what goes on in the mouth. Half hour later, that's pretty well done. Okay. Then the saliva and all of its beautiful contents are doing its job to remineralize the teeth. So if you're eating 2 meals a day, 3, okay, fine, whatever, your time with dealing with an acidic environment is pretty low in the mouth. If you're snacking all day or drinking even unsweetened sodas, your time in an acidic environment goes up radically, driving tooth decay. And I hear this all the time among my new moms. Never had a cavity until I had my baby. The baby took all my calcium. Fact or fiction? Myth or not? Myth. What has likely happened there? One thing to be sure, calcium metabolism and calcium regulation, the teeth are not involved in that process. They're not in that compartment, that physiological compartment, not available for exchange.
Right. Not like your skeletal system or
no, it is not available. Not available. So what happened? Well, tooth decay or cavities don't form overnight. It's a logarithmic process, 2, 4, 8. One person had COVID, 2, 8, the whole world. Over time, most folks get pretty good care from their dentist growing up anymore. And then we become young adults. I'm not doing that. It's just something mom made me do.
Right.
And then you add the college days or grad school days or whatever, where you're drinking Mountain Dew for breakfast because you're late for class.
Right.
Then you got a few years of those habits, and the next thing you know, you're adulting again. You've got cavities. Why? Well, not because the baby took no, because behavior changed for a while, and that's when it was diagnosed.
Right.
So we can see a flurry of tooth decay in very young patients, pediatric patients, patients that are put to bed with a bottle, baby bottle caries. We see it in my junior high school age kids, because they're on their own now, driving and putting money into vending machines. Then we see another increase in the young adults because they come back to the dentist. And then you got a pretty good quiescent period where, my mid-late 20-somethings through my mid-late 50s, don't see a lot of activity. Then it happens again. As you collect birthdays, the machine changes, physiology changes, mouth dries out. You start layering on medications, maybe.
Yeah.
Drying them out. As that beautiful saliva goes away and diminishes, that environment becomes more active for the bacteria. Again, in the absence of the antibodies and the protective mechanisms of the saliva.
Right.
So we see that. So no, babies aren't involved in that, other than your habits change and you're eating ice cream at night because you're having a baby.
Right.
You want that.
Right.
Another one is, it's a back tooth. It's okay. It's got a hole in it. It's kind of hurt. Just pull it. No one sees it. It's a back tooth, right?
Right.
Okay. That's the foundation of the house.
Right. Without thinking what caused that bad tooth in the first place, and process still going on.
Yeah. And that back tooth, that's where you ate your meat, your salad, your nutritional foods. You lose the back teeth. The front teeth, it's like the curtains, the pictures in the curtains. They're pretty, you bet. They're good for smiling. They're good for cutting through stuff to get it to the back teeth.
Right.
And the curtains and pictures are pretty. The wallpaper is, but it doesn't do much to hold up the roof.
Right.
So as you lose those back teeth, it's like dominoes. The front teeth fall faster. So the temptation is, well, if it's a back tooth, I'm not going to invest my time or money in restoring whatever's there. Please do, because that's where you choose your steaks, your salads, your vegetables.
Right.
Your nutrient
Should
dense
be.
foods. Yeah.
Right.
Yeah.
Now, you said something that I didn't know. You said that the saliva helps mineralize the teeth. What minerals are in the saliva? I wasn't aware of that.
Well, you've got all the same minerals that you find running around the body. You've got calcium, you've got phosphates, all these things. Look at, you've heard the term tartar, right?
Yeah.
Okay. So what tartar is simply mineralized bacterial deposits. That's all it is. So saliva is really super saturated with minerals. And what happens then is where you've got plaque buildup, algae, as that biomass dies, it absorbs those minerals, that calcium, and it becomes kind of rocky, right? But it becomes like calcite, stalactites. So that's what that is. So the body's designed beautifully to heal and to convalesce, right? So the master knew, okay, we're going to eat some occasional apples and oranges and all these things.
Right.
Yeah. So you're going to need a way of repairing that acidic attack. Well, easy. We'll put saliva there.
Yeah.
You got all you need to fix it.
Right.
And it does. So that's the mechanism.
Okay.
It's loaded with all the good stuff.
Okay. I was just kind of usually think of it as a amylase, because that's the main thing I think about as where carb digestion actually starts.
Yeah.
Is in the mouth.
Yeah.
But I never thought about all the other stuff that's in it.
Yeah. And there's antibodies in there too, things that help deal with the bacteria in the mouth and the bacterial load. So good question. You're a drug guy, right? You're a pharmacist. Something interesting we see with my patients that get addicted to Flonase, the inhaled steroids.
Yes.
Thrush, oral thrush.
Right.
Yeah, you bet. See it frequently.
And we talked about that when people take the oral steroid, our asthma patients and people with lung issues, when they take the oral one, we always tell them if they've had a steroid in it to rinse their mouth out first. I've never told anybody to do that with a nasal Flonase, like Flonase or any of these. Should we? I mean, is that if they do it in the how does it get from the nose? Because I know it's topical. It actually gets into the bloodstream right there, but it sounds like maybe there's something else as far as like the post-nasal gets in that way. Would rinsing the mouth out after even nasal, would that help? Look at it. I don't know.
I don't know if they've looked at it. I don't think it hurt anything. I do know that sometimes I can think of one patient, we had to pull him off of his inhaled steroids. He was quite addicted to it, and we couldn't keep his thrush under control. Physician, we kind of talked, and no, pull him off the nasals for a while. Thrush went away. Interesting. So, those things kind of interesting. You talked about hidden sugars in foods, ketchups, mustards, every barbecue sauce on the market for the most part. Save some of the primal branded stuff, Marxist and stuff. There's some things out there that don't have it.
Yeah, primal
there's tons of hidden sugars. Yeah, there's tons of hidden sugars in the foods.
Oh yeah, everything, bread, everything. People, they think they're eating healthy. Is like, please look at how much sugar's in this. I remember the 4 grams per teaspoon when you're looking at your foods, because it's a crazy amount.
That is. That's a fun little visual too.
Yeah. And one other thing, I know we're getting close to the end, but you did bring up something else that I think is important. I guess it sparked it in me because we have a lot of babies coming in, our friends and our family. We've got a lot of babies coming in. Talk about bottle propping and keeping the bottle in the mouth and how horrible that is, because I know a lot of people do that. They think, just give them a bottle, they'll fall asleep and let them fall asleep with the bottle in their mouth. Do you see that a lot? And what all is really going to be happening to that poor baby's mouth when you do that?
Yeah, that's a good question, Steve. There's something called nursing bottle caries, and it's a very aggressive form of tooth decay that we see when those babies are fed that way. Mm-hmm. The earlier tooth decay starts in the mouth, the more severe the problem for a lifetime. Okay. When babies are born, they don't have the bacteria present to produce cavities. We know that gum disease and tooth decay people say it's inherited. I know it's not, but you will see its distribution in certain families. So well-meaning mom picks up the pacifier, whatever it is, off the floor and does what?
Right.
Pops it in the mouth to clean it off.
Right.
Okay.
Yep.
Well-meaning mom or somebody feeds their child after they've taken a bite of something.
Right.
What you're doing is inoculating that child with good and bad stuff. Okay, fair. But if well-meaning grandma has got raging periodontal disease and shares a bite of her whatever with your baby,
Right.
all of a sudden that baby's got some pretty aggressive bugs in his mouth.
Like strep mutans.
Even worse, yeah, I'll say it. AA is the term, but Actinobacillus actinomycetum accomitans, big driver in gum disease and tooth loss from gingival inflammation.
Huh.
So those things happen early. So beware of that with the newbies. And I'll go back to get your kids in front of a pediatric dentist when the first tooth shows up.
Right.
Not necessarily for tooth decay, but for the kids' benefit of understanding where they're going. There's a lot of, there's a lot of folks doing braces in pediatrics, and they're doing it fairly well. There's a few of the folks doing braces in pediatrics that are board certified to do it. In other words, they had the extra residency and training of many years and gone through the certification process.
Mm-hmm.
Might be worth knowing the difference, and I'll just say it like that.
Okay. So if you're going to get any kind of braces, make sure that they've been trained in it.
Yeah. Make sure you've done some research on it, right? Make sure you've done some research. And the same with kids. Most stuff easy, but the certified specialists have got a little bit more to add to the equation.
Right.
Food for thought. I'll just leave it at that.
Oh, yeah. Especially if complications occur. They're going to be able to deal with it more.
Yeah. So those are good topics. How we doing? What have we left out?
I think we've talked about most of them. Talking about eating, tongue stripping.
Okay.
I think we've hit them pretty good. Oh, that's one thing I was going to say. You're talking about some people, they come in and they have these children that have bad teeth and they say, oh, this is genetic. This is same thing they do with obesity and type 2 diabetes and all this other stuff. There's it must be genetic. It's like, no, it's not because it's in your genes. It's because your mother ate a certain way. Now you eat a certain way. Your friends eat a certain way. So it's hard to, everybody thinks, oh, look at this horrible genetic thing that's going on without realizing it's the habits that you've installed. And if you do that, just like people who eat all this horrible man-made food now, they start their kids off on it. Well, even with infant formula, which is the same horrible man-made stuff instead of giving actual breast milk.
Sure.
And so now your kids become obese. And so they think, oh, it must be genetic because my mom was obese. I'm obese. Now my child's obese. It's genetics. And I think people use that as something to fall back on, which is the worst thing. Oh, yeah. Yeah. So now I don't have to change anything.
Yeah, takes it off.
So it's the same thing with the teeth, man. Eat healthy. Take care of your teeth. Brush.
Yeah, let's kind of say this too, Steve, if I can. The question is, why do I need to see a dentist if I don't have any pain?
Right.
Check engine light, gang. Arthrosclerosis doesn't hurt till you have the heart attack. We can see some conditions in the mouth, but I can't get clues if I can't look. Oral cancer is a big driver. You don't feel it a lot of times. I look for it every year. You've got HPV complications with oral cancer. You've got ethanol exposure. You've got tobacco. All those things. Vaping. We could run down that rabbit hole. I could teach a course in 5 minutes, maybe not. But you don't know if you don't look, gang.
Right.
I'm often on the front lines of diagnosing GERD because of what I see with the teeth. Sometimes on the front line of sleep apnea because of what I see going on in the mouth. So take home point, sometimes do the maintenance before the check engine light comes on, gang.
Right.
Get yourself eating good foods before the maintenance light comes on.
Right.
Food for thought. No pun intended.
Oh, it was too.
It really was, but I like it. We'll go with it.
Well, I guess that was all the questions I had, unless you have any. Was that your final answer?
I think that's the parting shot, and I'm honored to be part of what you're doing, and I thank you for what you're doing. And if there are follow-up comments that need to be made for what we've done today, please let me know. Happy to help in any way.
Oh, I will. I know I've learned a ton from this, and I so much appreciate you, and I appreciate you taking your time to do this. It was wonderful. I really appreciate it.
Glad to do it, my friend. You and your crew have a terrific rest of your day.
Well, you as well. And for everybody else, thank you so much for listening, and have a great week. And remember, make simple, healthy choices to live a quality life. If you enjoyed this podcast, please hit the subscribe button below and be sure to tell someone else who may want to change their health path as well. And don't forget, you can also purchase my book, Your Plate is Your Fate, on Amazon or Audible. And if you do, please leave a review.